and customers, and visitation continues to be banned at long-term care facilities except for certain compassionate care situations. So I'm just repeating what I think a lot of people already know, but we want to make sure people are clear about what's the same and what's different as of 5 p.m. tomorrow. Also, earlier this week, I convened another meeting of my Business Leaders Roundtable, had a very good discussion on how to assist particularly small retailers to reopen safely in phase 1. We're in the process right now of preparing a toolkit that will help small businesses create their plan and has other things that they can use like signage and templates for other documents that they can use to put safe practices into place in their business as they reopen. That is in the final stages of development and it will be ready for release on Monday. And with that, I will turn it over to Gibbie Harris for a public health update. Thank you.
Good afternoon. As of noon today, we had reported 1,932 cases of COVID-19 in Mecklenburg County and have had 59 deaths. We did have what I consider a huge success yesterday. One of our long-term care facilities is no longer in outbreak status. They have gone 28 days without a new case, and I do believe that's an incredible success for us. We continue to see a disproportionate number of cases in our Latino community. More infections are among younger Hispanics than in the other populations. That data will be coming out tomorrow morning and more specifics will be included. We have posted a new outreach toolkit in Spanish today and have been working with our Spanish-speaking media partners to get the word out about staying at home, testing, and how to best protect yourself. Our trends, especially what we're watching, are the percent positives and our hospitalizations remain stable. Actually, our hospitalizations have continued to decline slightly. I want to spend the rest of my time talking about the testing strategy that we have been working on with our community partners. So to date, over 36,000 COVID-19 tests have been conducted by our healthcare systems alone in Mecklenburg County. That is 3.2% of our population. Based on the data that we began seeing that showed disproportionate impact on some communities, our hospital systems put mobile and ambulatory testing sites in place, which have been very successful at reaching those communities where access to care can be a challenge. We are moving into the next phase of testing, though. We have been instructed by the state to develop a testing plan where we will be expected to test 5% of our population in the next 30 days. We've had that conversation with the hospital systems and with others in our community about how we can make that happen. The second goal for us, though, and probably the more important one, is assuring that tests are available and provided to the priorities in this strategy so that we can track infections, isolate the infected, and quarantine those that are exposed. This is the only way that we're going to continue to keep this under control. This strategy has been developed based on currently available testing information and state and federal guidance. It is subject to change as new information, testing tools, and guidance are released. Our testing strategy aims to test roughly 13,000 residents per week to cover an additional 5% of our population over the next 30 days. That is roughly 1,850 tests per day. We've actually reached and even exceeded that target for the last 2 days based on the hospital
and has other things that they
testing.
Can use like signage
so
and
we
templates
think
for
we're
other
in pretty
documents.
Good shape to move forward with this strategy. With this increased testing, we expect to see much larger daily case counts. And you're starting to see that. We had 76 new cases yesterday. We're already up to 69 today. We don't want to see rapid increases in deaths, or percent positivity, or hospitalizations. Currently, all of those indicators are remaining stable or are declining, as I mentioned earlier. Our strategy is focusing on testing that detects the presence of the virus. So we are not moving into antibody testing at this point. We know that that's somewhat available in our community, but our focus is really on identifying those folks who are infected. The process that we will use will divide into two different types of testing. One, our high volume providers, and those are our two hospital systems. as well as low-volume providers in our community. We already have some community-based organizations, providers who are doing some testing, and we want to work with them to increase that testing availability. Those are including our federally qualified health centers, our community clinics, our urgent care facilities, and private health care providers in the community. And we'll work closely with the labs in our community that are available to make sure that supplies are available as needed. This is a three-tiered priority approach that is using guidance from the state as well as discussions with our health systems to determine those priorities. We're already addressing priority group 1 and some of priority group 2. Priority group 1 we had in place before phase 1. That included individuals with moderate to severe symptoms, an individual with any COVID symptom who are also 65 years or older, have serious chronic health or conditions or weakened immune systems, our healthcare workers, live or work in congregate settings, or our first responders in our community. We're also adding individuals identified by the health department through cluster or contact investigation that we need to prioritize and refer for testing. Group 2, we will have completely in place within the 2 weeks of initiating phase 1. These are individuals with mild symptoms of COVID, including children, individuals with known medium or high-risk exposure who work in a healthcare facility, work in a congregate living setting, or our first responders. We're also looking at individuals undergoing medical procedures for whom testing would impact their care management. And as I said, some of Group 2 is already being tested. Group 3, we are looking at having in place in 2 weeks of initiating phase 2. These will include individuals who support critical infrastructures in our community and are prioritized and referred for testing by public health for reasons that will be identified. We're also looking at individuals without symptoms for sentinel or other public health surveillance as determined by the health department and the local health systems. The logistics of the plan are still being worked out, but as I said, we've already moved into Group 1, testing those individuals. We're moving into Group 2, and Group 3 will follow shortly thereafter. The logistics and the specifics will be rolling out over the next week, and I'll be happy to answer questions once we're, okay, I think we're ready for questions at this point.
Hey, Gibbie, it's Joe Bruno.
How are you?
I am looking at an email sent to you on April 22nd at 5:49 p.m. by Scott Levine, the health director in Franklin County, who warned his fellow health directors against staying silent over soft reopening plans. And he says that he fears we have not learned anything from the lessons provided in the pandemic 1917 to 1919. Do you share his concerns about reopening North Carolina?
I would not be a public health professional if I did not have concerns. However, concerns can't stop us from moving forward. I was having a conversation earlier today, and I think what we are doing now is working as a community to manage this situation. We cannot continue forever to be isolated. We know that we have COVID-19 in our communities, and we're going to continue to see spreads. The question is whether we're able to manage this well, and that's going to depend on a number of things. One is the slow increase of accessibility to services in our community and an opening of our economy. But while we're doing that, we need to be watching our data and responding accordingly if we see increased cases at a rate that's not sufficient to maintain management of this in our community. People are going to continue to be infected with COVID-19 regardless of what we do. And the question is whether we can move forward as a community, continuing to protect the most vulnerable and making sure that people are doing their part in helping protect each other while we're opening our community back up.
Allison Kuznets from the Charlotte Observer. Could you talk about the backlog in coronavirus tests and how that may inform policy making moving forward, as well as the average length of time between when somebody is tested and gets the results back and then you get that information?
So when you talk about the backlog of tests, I think, are you talking about the tests or the availability of the testing materials?
For both, getting the results and getting the supplies to have the test.
We've been in conversation with LabCorp and several other labs that are servicing our community, and at this point, we believe that the plan that we're putting in place can be achieved based on what they have available to us. Each priority grouping that I mentioned, each tier, we expect to be able to get test results back in 72 hours. If we move into another tier and we see that the tests are taking longer to get back, then we're going to have to back off that a little bit. Test results past 72 hours are not terribly helpful in managing this disease. So that is part of the plan, to make sure that we're getting test results in at least 72 hours. Right now, test results are coming back mostly within 24, but at least 48 hours.
Hey, Gibbie, it's Tanya Mendes from WCNC. I've got a question for you. We've got a couple of cases that we've heard about of family members saying, I have a loved one who has it and I'd like to have my children tested. They have no idea how to go about getting their kids tested, or they cannot get them tested because they are asymptomatic. When do you see some of that contact tracing directly start to impact families so that they can get asymptomatic members of their families tested if there is somebody who is in fact tested positive in their household?
Part of that will start happening in Tier 2, in Group 2. We will see some additional testing of asymptomatic individuals based on the exposure that they've had and the situation that they're living in or working in. And then that will continue to increase in Tier 3 as we move forward. So I do believe that people are going to find that more available. We are going to try to manage that, though, and that's why those types of situations will be evaluated by the health department and determinations will be made about referral for testing.
Gibbie, under faith, you, me, Dena, 6 other journalists on this call can go to Crowder's Mountain for a hike, swing by South Park Mall to shop on the way home, and then grill out in the backyard. Are you comfortable with people doing those activities as soon as this weekend, and then possibly seeing a flare-up in cases 6 weeks from now?
So a couple of things. As we look at things opening up after 5 o'clock on Friday afternoon, you need to understand that the stay-at-home order is still in place. Those businesses are opening up, are available to individuals who need something from that business. This should not be seen as an opportunity to go back to business as usual, to hang out at the mall, to walk around, to stroll, and to shop. The intent is for resources to be available to our community as they need them. So we are asking for the community support in this. We still have a stay-at-home order in place. We need you to social distance. The guidelines that have been put out about the shopping that you may want to consider doing is know what you need when you go, not just to shop. So again, we are depending on the community to be a major part of the solution here for us and not to act as if we're going back to the way things were before Christmas.
Gibbie, this is Eric Spanberg with the Charlotte Business Journal. Picking up on Joe's question, what are your big concerns about the loosening of the restrictions or the start of phase 1? And then secondly, there hasn't been really much said about when people begin to return to offices and what kinds of public health standards would be in place or expected with that situation.
So my biggest concerns is are exactly what I talked about, is that people don't take the continued stay-at-home order seriously. So I would reinforce that we're asking people to do that and continue with social distancing and making sure that we are protecting each other in our community. We will be watching our data. We should know the impact that this is going to have within the next couple of weeks. We will see that in the data. And I've lost your second question. Oh, offices returning, thank you. What we are asking, and this is guidance from the state as well, is that people continue to work from home and telework as much as possible. We're not recommending opening offices completely back up at this point. I know that the city and the county are not planning on doing that, and that if you do need to open back up an office, you're still being asked to do the same things that we're asking retail to do in terms of social distancing and cleaning and limiting the number of individuals in a space.
Gibbie, it's Allison Kuznets again from the Charlotte Observer. You had told the county commissioners on Tuesday that the hospitals had pretty significant surge capacity. Could you talk about exactly how many ICU beds and ventilators are available? Because the models released on Tuesday show that there would be hundreds of missing ICU beds and ventilators if we do peak in July.
So what I can tell you right now, based on the data that we have, and I don't have all the specific numbers in front of me, is the hospitals have been running around 60 to 65% capacity, which means they've got quite a bit of capacity in the beds that they currently have, and that's before they build out any surge that they have planned if needed. And at this point in time, we have a lot of vents available, ventilators available. The number of individuals with COVID who are in the hospitals have decreased, and the numbers needing ventilators have decreased over the last 14 days. So I do believe right now we have capacity. The hospitals have started opening up for more elective surgeries, and so we are seeing some of that capacity being taken up with those individuals coming into the hospital, but there's still significant capacity in the hospitals at this point. We understand that at some point, if we did peak, we may need some additional ventilators and ICU beds, but that is part of their surge plans, and they are ready to move into those plans if need be.
Hi, Gibbie. This is Hannah Smoot. Mecklenburg is seeing by far the largest number of cases and deaths. Does it make sense to reopen Mecklenburg on the same timeline as the rest of the state?
Well, we've seen more, but if we look at our trends, they've been pretty stable. So the numbers that we're seeing are larger. They've been larger since the beginning. We've got a denser population. We've got a larger population. And we also have a more mobile population. We have individuals coming in and out of our county every day to work. So it's not unusual to expect us to have more cases. But as long as we're looking at our trends and they're staying stable, I think we are in a position at this point to move forward with the governor's phase 1 and pay very careful attention to that data and make sure that we don't see any spikes.
Gibbie, it's Hunter with WCNC Charlotte. If, like you said, when things start to open up, you expect to see some more cases. How many more cases would have to happen or come back positive for the county to look again at shutting things down?
So what I'll say is we will not look to the number of cases to make that decision. We are going to expand the testing we're doing, so I very much expect to see an increase in the number of cases. We know that we have more COVID-19 in our community than the numbers that we've currently seen just because we're not testing widely. So as we test more broadly, we will see more cases. What we will watch is the percent of positive individuals based on the number of cases we're doing, as well as watching our hospital census rates. Those are the things that are going to tell us whether we're seeing spikes or not. So we'll continue to look at those. Just know that our cases are going to go up.
Hey, Gibby, this is Derek with Fox 46. I want to follow up a little bit on Eric Spanberg's question because I had a point of of actually asking the governor about this, about minimum guidance for offices. He's basically saying that it needs to be left up specifically to those office buildings and the people and those businesses specifically themselves. But is there any minimum guidance as far as what you're basically telling some of these businesses that might want to get back into at least somewhat normal operations as to what they need to be doing to make sure your employees are safe?
So they're being given the same guidance as the businesses that are opening up with retail. They need to be able to social distance. So if you have an office that has a large number of cubicles, you need to make sure that you're not filling every cubicle if it puts people within 6 feet of each other. If there is the opportunity to wear masks when people are closer than 6 feet, that's what they ought to be doing. They should be cleaning surfaces that are used and touched by more than one person regularly. The things that we all know that they need to do. And again, if teleworking is working for you, and you may need to bring people in for short periods of time to do some specific kind of work, I would continue to recommend that. Again, we're still under a stay-at-home order, so as much as people can stay home and social distance, that's what we're asking.
Gibby, if our hospitals are overrun with patients in 6 weeks, who will be to blame?
I don't anticipate being overwhelmed in 6 weeks. We will know sooner than that whether we are seeing increases, and we'll start addressing that appropriately, whether that is in whatever way we need to do that, whether that's looking to the hospitals to reduce again the number of elective surgeries they're doing to free up beds, whether that's moving into a situation where they are needing to start doing some surge capacity. So I don't anticipate that we're going to be in a position where all of a sudden 100% of our beds are filled and it snuck up on us. I think we're going to be able to watch this and be able to respond appropriately.
It's Tony Messia with the Charlotte letter. One of the aspects of the governor's order is that it allows counties to go beyond what has been what the governor put in. Is Mecklenburg County currently anticipating any additional orders or any additional restrictions that go beyond what the state is doing?
We are not anticipating that at this point. There has been agreement between the city, the county, and all of the towns that we are going to go by the governor's tiered plan at this point. But in conversation with the state, we also recognized, and they recognized, that we're going to look at our data here in Mecklenburg County, and decisions will be made that are the best decisions for our community. As much as we can, we're going to stay in lockstep with the state.
Can you just clarify for me, that 5% goal, is that 5% total or 5% of an additional 5% on top of the 3.2% already tested?
We are looking at 5% of our population over 30 days. So that's in addition to the 3.2% that have already been tested.
Gibby, this is just wondering, so North Carolina ranks 19th in cases, 20th in deaths, and it was the 45th state to finally ease restrictions. Do you think it's definitely time to start the phase one, or would you be in favor of it, like actually extending this further?
I think the fact that we still have a stay-at-home order in place while we are starting to loosen some of the restrictions is a reasonable approach. I want people to understand that the stay-at-home order is still in place, even with the restrictions being loosened up. So I want to reiterate that. I think we need people to understand that. People have been cooped up for a long time, and it's very easy for people to see the restrictions loosening and think that it's back to what was normal before. I'm not sure at what point we'll be back to what was normal before. So right now we need everybody's help in continuing to do the things that we know that we need to do to protect our community.
Gibby, this is Ruben Jones from Spectrum News.
that a lot of people have been away from their loved ones due to some of those restrictions, of course. What is the timeline, and what will the county need to see to allow people to see their loved ones in person again in those nursing homes?
Well, if you'll look at the governor's plan, there are no plans within for the first, second, or third phase to open up nursing homes. That is such a vulnerable population, and we know that the cases that we're seeing in the population have come from the outside. So I don't anticipate that opening up at least until the end of phase one. I agree. I don't think that's a good idea. I think it is, it's a challenging situation. It's very hard not to be able to be with your loved ones, but it's the only way we have to protect them right now.
Gibbie, this is Reuben Jones from Spectrum News. I'm curious, as you increase the number of tests, how often would someone need to be tested? What is the goal there?
That's an excellent question, and it's one that it doesn't have a lot of clarity, and there's not a lot of agreement on exactly what that time frame is. I know our hospital systems are using different ranges for their teammates who are being tested because of exposures and retesting them. It ranges anywhere from 2 to 8 days at this point. So I don't anticipate us getting into the habit of testing people on a weekly basis right now. I really don't think we have that capacity at this point.
Hey, this is Katie Peralta with the Charlotte Agenda. I had a quick question for Dena about the business roundtable. Just was hoping that you could explain a little bit further what sort of guidance you're looking for from the business roundtable moving forward. And in addition to that, what will be included in the toolkit that you mentioned that's going out to small businesses reopening?
So the guidance that we're putting together right now is sector specific.
For signage, so that small businesses can sort of take this stuff off the website, use off the toolkit, they can customize it to their business, and then they can have those plans in place for when they decide to reopen. And so we're going to move on from retail. Gotten a lot of questions from personal care businesses, hair salons, nail salons, that kind of thing. So we'll be working on that. We've also gotten questions from fitness facilities. You know, how do we keep them safe as we move into phase 2 eventually. So we'll start to work on that. Also gotten some questions from food and beverage who are on our committee as well, who would like us to spend some time putting guidance together on that sector. So it feels like we've gotten this niche going where we can help put together guidance for various different sectors and push that out. And we use the business roundtable to give us guidance and also to ask us questions about things that they're wondering that we need to kind of run down and put together in this toolkit and future toolkits.
Some time putting guidance together on that sector.
This is Jericho Fox 46. I have another question for Dena. It's a little bit about the town-county divide, because I know part of the reason that we kind of backed out of the county order was because, even though this was not explicitly said, that some towns were expressing some reservations about continuing on with the county order. Are you seeing, or are you hearing from the town specifically about any more towns that are okay with going with the state, or are they still having reservations? And that we kind of backed out of the county order was because, even though this was not explicitly said, that some towns were expressing some reservations about continuing on with the county order. Are you seeing, or are you hearing from the town specifically about any more towns that are okay with going with the state, or are they still having reservations and are potentially wanting a county version of the order?
No,
it kind of extended.
Yeah, no. So the county, the city of Charlotte, and the 6 towns collectively agreed to let our order expire and to move to following the state's order, and that's where we are today. Okay, we'll take one more question, please.
It's Allison Cousins again from the Charlotte Observer. I had a question for Gibbie. As far as expanding testing and recognizing that as little as 5 to 10% of infections are counted right now, how many more infections would you expect to see in the coming weeks? How many are underrepresented right now?
I really don't have any way of projecting what that number will be as we go from, we were averaging about 700 to 900 tests a day, and now we're moving up closer to 1,800 a day. We could potentially see an extra third to a half, but I really don't have any way of knowing for sure. We'll have to watch that data. Thank you.
This was a special report from WCNC Charlotte.